Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Suicide. It's a word that makes us uncomfortable, a topic we often avoid, but the truth is suicide is a serious public health problem. It affects people of all ages, backgrounds, and walks of life. The impact of suicide is devastating, leaving families and communities heartbroken. Understanding suicide is the first step toward prevention. We need to talk openly about it, to break down the stigma, and to offer support to those who are struggling. This essay aims to shed light on this complex issue. We'll explore the causes, signs, and ways to get help. Remember, there is hope and help is available. Suicide is never the result of a single factor. It is a complex issue that often involves multiple elements coming together. It's usually a complex interplay of mental health conditions, life events, and other contributing factors. Each of these elements can add to the burden a person feels. Mental illness, like depression, bipolar disorder, and anxiety, is a major risk factor. These conditions can cloud judgment and make it hard to see a way out. These conditions can distort thinking, making it difficult to see solutions or hope for the future. They can create a sense of isolation and despair. Life events such as job loss, relationship problems, or financial strain can also contribute. These challenges can feel insurmountable and overwhelming. These events can trigger feelings of hopelessness and despair, making it hard to cope. The weight of these experiences can be crushing. Other factors like substance abuse, social isolation, and access to lethal means can also increase the risk. These elements can exacerbate an already fragile state of mind. It's important to remember that suicide is never a sign of weakness. It is often a sign that someone is experiencing unbearable pain and sees no other way out. It's often a cry for help, a desperate attempt to escape unbearable pain. Reaching out and offering support can make a significant difference. Recognizing the warning signs of suicide is crucial. It's a matter of life and death. Often people who are suicidal give clues about their intentions. These clues can be subtle or overt. These signs can include talking about wanting to die, feeling hopeless, or being a burden to others. They might express these feelings directly or indirectly. Changes in behavior, such as withdrawing from loved ones, increased substance use, or giving away possessions, are also red flags. These actions often signal a cry for help. Physical symptoms like changes in sleep, appetite, or energy levels can also be indicators. These changes can be drastic or gradual. Pay attention to any sudden shifts in mood or behavior, especially if they seem out of character. These shifts can be a sign of inner turmoil. If you notice these signs in someone you care about, don't ignore them. Your intervention could make a significant difference. Reach out, express your concern, and encourage them to seek professional help. Sometimes just knowing someone cares can be a lifeline. Section 4. Seeking help, diagnosis and treatment. Understanding the process of diagnosis and treatment is crucial for those struggling with suicidal thoughts. There is no single test to diagnose suicidal thoughts, making the process complex and multifaceted. Mental health professionals use a combination of interviews, assessments, and observations to gather a comprehensive understanding. They will ask about thoughts, feelings, behaviors, and any history of mental health conditions, ensuring a thorough evaluation. Treatment for suicidal thoughts depends on the individual's specific situation and needs, tailored to provide the best support. Therapy, such as cognitive behavioral therapy or CBT, can help people identify and change negative thought patterns, offering new perspectives. Medications, like antidepressants, can help manage underlying mental health conditions, providing chemical balance and relief. In some cases, hospitalization may be necessary to ensure safety and provide intensive support, offering a secure environment. Remember, seeking help is a sign of strength, not weakness. It shows courage and the will to improve one's life. It's the first step toward healing and recovery, paving the way for a brighter and more hopeful future. Section 5. Prevention and support. A shared responsibility. Preventing suicide is everyone's responsibility. We can all play a role in creating a culture of support and understanding. Educate yourself about suicide, the risk factors, and warning signs. Talk openly about mental health, challenging the stigma and encouraging help-seeking. Support organizations working to prevent suicide and provide resources to those in need. If you or someone you know is struggling, reach out for help. Contact a crisis hotline, mental health professional, or trusted friend or family member. Remember, there is hope and help is available. Let's work together to prevent suicide and save lives. UMCC, your ultimate medical consultants connector.